In this day, we are going to go through one of the important lecture in health education, which discusses about the social marketing. What does mean the social marketing? Yeah, the marketing. It is not just we are going to sell some products or we are going to sell something. Just we are going to do the market about the health behavior that can lead our community to be more interested or more follow about the health issue. 1 minute. Yes. Yeah, this is the social marketing. We are going to sell the health behavior to our community to be more interested to follow the health health behavior. In this lecture, we are going to go to see the introduction and also see the 4 P's, as you know, in the marketing: place, price. Yeah, this is the called 4 P's. Additionally, we can go through the know your audience, the heart of effective social marketing. It's very important about to know about your social marketing. Additionally, we can go to see some successful story which taken place around the world, in Guatemala and also in USA and in different countries. Yeah. Additionally, we can go to see the challenges which is going to facing us when we are doing the social marketing. Moreover, we can go through the conclusion about the marketing. Yeah, this is a uh, very important lectures as your public health specialist to know market how you can market the health good health behaviors. In the introduction, as I mentioned it, when you are hearing about the marketing, it is not just we are going to buy you smartphone or something, some food. Is about the promote health behavior. Social marketing is defined as a systematic application of the marketing concept and technique to influence voluntary behavior for the benefit individual and society. Additionally, in the world, you know about the health choice or let us with the social marketing can let us to let the health behavior to be more attractive and more accessible and more desirable for the population. Yeah. This is why it's very important to understand the techniques about the marketing, social marketing. As you know, now the Coca-Cola as this voir, it is it is not for the people, not tell the people you have to buy this here, but just he do the Coca-Cola or the product to be more friendship and more enjoyable and more refreshment. That's why we are going to in social marketing, we are going to apply this logic or these techniques to our product. Our product here, it is not. It is like hand washing. Hand how can hand wash? This is some behavior can let us to promote the health. Yeah, and hand washing and vaccination and quitting smoking. The message it is not you must do or you must do this here, but can feeling better and safe, more respectable if you do. Why you do? Why does this matter? Because information alone rarely to do the change. Not just give some person information about the cigarettes, it is not good, but just it is the give the some person information, it is not enough. Yeah, it is not enough to change the behavior, but sometimes it's good to let that things to be more attractive and more better. This is about the social marketing. Now let us to see the now let us to see the four piece here. In the marketing or people they are doing the marketing, there is some strategy of the marketing. Call it four piece. Piece number one is called the product. In health, we're not going to see the product as like Coca-Cola or something is going to eat. Our product in health, we are going to do the desired behavior or what is the benefit for you. The product, it is not physical items. Yeah, it is behavior. It is behavior like using betnet. Sometimes some people they have the betnet, but unfortunately they couldn't use. Yeah, in our product here, it is how how we can change this behavior or how we can do this behavior it is be applicable or to be more practical in our community. Plus receiving the value when you are using the betnet, the value you are going to receive it is protect your family or your child from the malaria. Yeah, people adopt the behavior not because they are right, but because they are deliver personal and social reward. Yeah, one of the four piece is the product. Now let us to see the second piece. As you know, this is a strategy of the marketing. Is the four piece. One piece, as I mentioned, it is the products. In health, we are not going to focus on the products. Just we are focusing about the behavior. When we are adaptive, the good behavior our benefit we are going to protect our community or our family from the malaria. Now let us to go to second strategy or second piece of the marketing. It is the price. Here we are not going to see the price exactly, but here we are going to see the barrier. What things let us to not follow the good behaviors? What is the barrier? What is the block us to do the good behaviors? The price include more than money. It is not money. Price includes the time and effort and stigma and inconvenience. For example, getting test for the HIV may be carry high emotional price due to fear of the judgment and social marketing is reduce the price by offering confidentiality and use friendship clinic or peer-led testing. As I mentioned, the product or the price, it is not money here. It is used like stigma. Sometimes if there's someone is going to do the HIV test, perhaps he will think he will think about the stigmatization. Yeah, but when we are doing things in the good marketing, like not let's say some person is going to allow, yeah, just he can go with the train, and additionally we can provide the testing confidentiality, not let all people know about that, yeah, to reduce the stigmatize, yeah. This is a call it barrier adaptive, yeah, to let the people not stop to go to do good behavior. As you know, when you are checking HIV test, that can help you to protect and to protect yourself or to control the HIV. When the when we are using good strategy like peering testing of the HIV, or sometimes we can keep the confidentiality information. We are not going to share this information with the people that can let or can give the hope for the people to go the test, yeah, to protect themselves, yeah. This is the second piece of the strategy of the marketing. Now let us to see the third piece is called the place, accessibility or convenient. How you can convenient to be available. Yeah, that means, yeah. Where and how the people access behavior matters. One farmer to use the clean water. Install the filter at the communal well. Want the teenager vaccination over the shot at the school, sport event, and pop up the clinic. Yeah. Accessibility, that means sometimes some people they have interest to follow the good health behavior, but unfortunately he couldn't find them. Like example, uh, when you are use the clean water, that means you are going to protect yourself from the cholera or some disease or contaminated disease. Yeah. But the problem is it is not available, or the clean water it is not accessible. It is not there. In my community it is not there. By the marketing we can let these waters, these good things to be available. When it's available to be easy to reach it, yeah. By this way also we can reduce or can upgrade the the positive health. This is the second piece, or second piece, as you know. This is all of them call it the strategy of the marketing. The last piece, or last piece, it is called it promotion. It's promotion, that means the strategy that you are going to communicate or to discuss with the audience, yeah. Which strategy is suitable for you to market your health behavior or to market the positive health behavior. One of the promotion way we can use the social media. Now social media is available. Many people they are using. We can use social media, Facebook, TikTok, to send the good health behavior. This can help us to disseminate the good information or good health information. Secondly, local radio. This is the second strategy that can help us to use to disseminate the health information. The third, sometimes can discuss or can let the leader, community leader, specialist, religion mans, or let me to say the faith leaders to send them the message. Yeah. Sometimes we see in the many countries, in the many place, the health promotion disseminate the information through the faith leaderships, yeah, in at the mosque level and also at the different place, yeah, to tell them the vaccination is good, or to use the clean water is good. Yeah, this is a strategy. This is the four four pieces as I mentioned. One of them is the product, and we are mentioned in this place we are not going to use products, but we are going to use to change the good behaviors. This is the one piece. Second piece is the talk about the price. We are used about the price, and we are mentioned. Here we are not going to price. We are going to adapt the barrier. What things to stop us to not use the good health behavior. The third piece is the place can let this service or these things to be more available or convenient to the community. Last piece is a promotion, and I mentioned it. We are going to use a different strategy like TikTok or social media and radio, national radio, and also face leaders. Yeah. Now let us to see know your audience. This is one of the very important things to know. If you need to send the message or to upgrade the health of the community or the people, you have to understand, know, know your audience, who you are going to send the message. Not all of people they receive the same message. You can decide or detect your audience. To decide or to detect your audience is like a heart of the effective social marketing. When you are detect your audience, that easy when you are send a message, easy they can understand you and can follow that message. Yeah. Because sometimes you are talking about the quit or stop of the cigarette among the youth. And this audio and this message you are going to send for the elder people, it is not good, yeah, because most of them they are not smoking even. But you can find a sample of them. Yeah. That means you can decide whom you are going to send the message. That means when you are going to give them the message about the cholera, that means those people they are affected or they are suffer from the cholera. When you are going to talk about the smoking, that means those people they already smoking or they perhaps they interested to smoking, yeah, to stop. To know your audience exactly, yeah. Not because sometimes especially the sport news. Sometimes the elder people have an interest, but the majority of the youth they are interested. Yeah, yeah, because it's very important when you are sending a message to know your audience. Yeah, this is considered at the heart of the social marketing. When you are going to do the good marketing, you have know your audience. Know your audience is the heart effective of the social marketing. You cannot market to public. You must segment your audience. Like if you are going to be influencer or yeah or social marketing or less modern or yeah, you have to segment your audience who they are going to send the message. Like now when you are a health promoter, you have segmented detect your audience. Not all people in the social media you are going to send a message, especially yeah, just you can select the special people there. Identify the specific group which share the value and barrier and influence. Yeah. You have to decide or to identify a specific group that shares the same value, same interest, and same barrier and influence. Secondly, ask them who are they? Know their genders, know their age, occupation, culture, identify. Secondly, you can ask them or know about what do they care about, what's their interest, what's their value, the interesting for their family, their dignity, or the independent or their peers. Additionally, you can what stops them, what things let them to be stopped. Yeah, like is it shame things or trust or cause or tradition. Additionally, what do they trust? Yeah, yeah. What thing they are trust on it? Yeah, this is a very important when you are doing to hard to segmentation of your audience. Now let us to see the some example about the promoting condom use among the young men. These are some example use social marketing. A generic message like condom prevent HIV often fail, but research show young associate the condom with reduced pleasure or lack of masculinity. The campaign must be reform the narrative. Use the respect man or rule model. Athletic message real strength to protect your partner. This is the example when you are when you are need to let the young men to use the to use the condom. It is not going to tell them the condom is going to prevent you from HIV. Just you can let the message to be more soft and more empowered. Like real strengths, it is protecting your partner, your wife, your girlfriend. This is a this is by this way you can let them to be more aligned with the health message. Distribute condom in the in the discreet, appealing packaging at the barber shop or game. Also, can distribute the condom at the games or at the shop or some place which they are gathering or they can find them. Yeah. It is not provide the condom in the very far place or it is not accessible for them. Yeah. Let the condom to be available and additionally tell them when you are using the condom to protect your partner. Is a strong, real strings. Yeah, real strength to protect your partner. This is the one example. Now let us to see the next slide. It is a real world success stories. This is a some example taking place around the world about the social marketing action. This one example about the truth campaign in United States of America. Instead, lecturing the teenager about the lung cancer, truth expose how the tobacco companies manipulating youth by framing smoking as submission to corporate agree. Immediately quitting a revelation, no sacrifice, return must. Yeah, this example mentioned or take place in United States in the some of the big campaign take place there. Uh, they 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 are going to let the youth to stop or to quit from the smoking. They not tell them smoking they are is going to smoking is going to let you to be affected or yeah to be affected by the lung cancer. No, no, not focusing for that. Just they are mentioned and told them the money or the companies, smoking company, they are manipulating you and manipulating the news, disinformation, the news. Yeah. When at this campaign, when the money money use in United States at that campaign realize the companies of the company smoking company they are manipulating them. Majority of them they are stopped or they are quit from the smoking because sometimes when the tell someone when you are cigaretting you are going to affect by lung cancer, but sometimes it can respond for you. Yeah, I know many people they are smoking, but unfortunately, even now they couldn't affected by lung cancer. Yeah. But just when you are reflect or explain them the manipulating which many things which you doing by the smoking company, sometimes there are some paying the money and to hide or to this information. Yeah, that's why I let them to stop or quit from from the smoking. Second, social marketing taking place in Australia. Stop at its start. Targeting parents of adolescents. This campaign uses to real family conversation to show how the everyday exists remark, normalizing the violence by poisoning the parent as the culture and shape to empowering them to intervene early without the blame. Also, this social marketing taking place in Australia because yeah, to stop the aggressive between the teenage. Yeah, targeting parents. Yani this campaign they are focusing for the parents of the adolescents in the campaign and let them to show how the everyday socio remark and violence, yeah, and explain them how the violence is going to affect for their life and also their families, yeah. Yeah. In this campaign, majority of them they are responsive, yeah, because many of them they are doing violence, but when they are targeting them, advising them, participate in the campaign, that lets them to understand very well about the importance of that issue. Now let us to go to next example about about hand washing program in Guatemala. Rather than distribute the soap and walking away in the at the Guatemala there, just their their include the school children and also catching radio jungle reinforce habits and also at the school level there. The result of this campaign, which is taking place in Guatemala, the hand washing with soap is increased by 300% in the targeting communities. That means majority of the people they are follow because the involved with the children and the children they are become the ambassadors that led the whole community as the Guatemala they are fixed that problem. Deep audience insight and emotional and social influence. This is a common threat here. Now let us to go and see the challenges and ethical consideration of social marketing. Yeah, it's very important to put it in our mind. The challenges. One challenge is of the social marketing, perceiving manipulation. Yeah, perceiving manipulation. Solution be transference. Talk truth. Say what say we are sharing this because your health matter. Avoid the fearing them. Avoid to tell them this will kill you. This can cause some big problem. This. Not we are going to manipulate them. Just we can go and say transfer. We are give this news or this awareness because your health matter to keep your health. This is the one of the social marketing challenges about the receiving the manipulation. Yes, you can handle by this way. Now let us to see the second challenges of the social marketing is the limited resource. Sometimes we have not enough resource to do the social marketing, but the solution for this issue, we can do WhatsApp groups here because you can send a message when not have enough resource to organize the campaign, to organize the symposiums. Just you can do the WhatsApp groups and send in the message and put it and do or use as the platform. Additionally, can use the community theater at the community level. You can see the some artists and do the community theater to reflect the healthy or bad healthy issue to let the community to be more aware and do the good behaviors. Sometimes you can do can doing the samsa in the theater and see some people they are smoking and they are affected by the lung cancer, doing something like that. You can let them to understand exactly problem here. Additionally, you can school clubs with the school or the children also can help us to handle the resource issue because at the schools clubs you can find many schools and the children as considered as the ambassador for their families. Yeah. When you teach them or give them some theater, they can reflect that things among their communities and let them to follow or to upgrade their knowledge. Yeah. Moreover, we can handle the limited resource by local research, religious can sit with them and give them the message when they are met their communities, they can send this message and can by good can handle this issue. This is the second challenges which is facing us during social media. Now let us to see the third challenges, which is cultural or religious resistance. The solution: partner with the cultural insiders and frame health behavior as allied with the core value. uh, when we realize some culture or some religion, their resistance or health behavior, we can involve them and let them to be part of that activities or that behavior change activities. Like involve them, tell them the face, the face, our face, to let the people to be more to follow the health behavior because protect themselves. Yeah. Protect yourself is the value in the many religions. Yeah. Additionally, can protecting your family by further reading. Yeah. Also can mention this. Yeah. This is a concern for the cultural and religion resistance. Yeah. Now let us to see the conclusion of the market health with heart. As you know, marketing helps with heart. Social marketing, it is not about the tracking people into doing what is expert want. It is not let the people doing as the public health expertise want, but it is about listening deeply and remove the barrier and making the health feel worse while not just correct. Yeah, yeah. The social marketing, it is not just let the community or people do as we need. Yeah, but we are listening deeply, listening up from them and remove the barrier. Sometimes there is a barrier and we couldn't saw it or we couldn't see it. Yeah. But we are going to change the ideas to remove that barrier and make them to do the health behavior and he interested. Yeah. From number one. I have to wash my hand. I am the kind of person who keep my family safe. Yeah. Instead to say wash your hand, but when you are wash your hand, you can save your family. Should quit smoke. I'm taking control for my future. When you are stopping the smoke, you are going to control you. Yeah. This is a live speech, yeah, about the conclusion. As I mentioned, the social marketing, it is not about tracking people into doing what expert want, but it is a listening them deeply and remove the barrier. Thank you for you. Now, follow for you if some person have the question or comment, the floor for you. Now you can share your ideas. Any comment, you are welcome.